Suicide is defined as the act of killing yourself because you do not want to continue living, but living not only means not dead, it also means having life. The illnesses that some people endure have changed their life to the point where it is missing components that give it joy and meaning. Aid in dying laws would help mentally competent, terminally ill people avoid additional suffering and meet death on their own terms with safeguards implemented to prevent abuse of the procedure. Today I'll be telling you about why an Aid in Dying Act should be a legal option available to patients in need. My hope is that there is no need for you or someone you care about, but if it does come into your life, you don't want to waste precious time fighting for the right to make that an option. First, I'll tell you where Aid in Dying stands in our country. Next, I'll present some reasons for legislation and discussion on opposing viewpoints. And lastly, I'll give you some ideas to think about when you're considering where you stand on the subject. If you, like me, think there is a need for an Aid in Dying Act, we are not alone. According to Support for Doctor-Assisted Suicide article presented by editor Noel Marino in the Opposing Viewpoints, published 2016, it contains a 2015 Gallup poll taken annually between 1997 and 2013, where people were asked, when a person has a disease that cannot be cured and is living in severe pain, do you think doctors should or should not be able to, allowed by law, to assist the patient to commit suicide if the patient requests it? Consistently, every year, the majority thinks it should be allowed. Aid in Dying Acts have been signed into law into 4 states, Oregon, Vermont, Washington, and California. California's End of Life Option Act will take effect June 9th, 2016. There is no federal legislation in each state, and each state needs to decide on their own. In Oregon, the Death with Dignity Act began allowing the practice in 1998. The Oregon's Death with Dignity Act and the Washington law have a process that allows a patient to get a lethal prescription, and it is written to prevent abuse in the law. A few, but not all of the safeguards are. The request has to start from a person that has a terminal illness. This diagnosis involves a second consulting a physician. Patients must request a lethal prescription twice verbally and once written in written form, and there is a waiting period of at least 2 weeks between the first and last request. The doctor who writes the prescription must believe the patient is mentally competent to make the decision. Also, the law requires the patient to be able to take the pills on their own. State health agencies are required to provide annual reports on how often physician-assisted suicide is used and by whom. These laws are giving people in a very bad situation freedom for an option that when they don't have very many good choices left. Some people oppose a law saying that adequate pain control can be made available with improvements by mandates and better educating health professionals. I agree that this would be a great improvement, but it does not take away the need for legislation, because pain is not the only reason for wanting to enact their right. According to 2014 Patients' Concerns While Seeking Life-Ending Prescriptions, the poll in assisted suicide in the United States, pain was only one of the factors involved in the decision. 91.4% said that losing autonomy was a reason for the reason that they enacted the decision. And 30% had to do with pain, and 4.8% were financial implications, which is a good thing, because they don't want that to be a reason. In states without a law, we are able to stop treatment and take people off life support. I like the way David Mayo, a bioethicist and professor of philosophy at University of Minnesota, says in Reed Karim's May 17, 2013 article, CQ, Assisted Suicide. Now, I can't give you drugs to kill yourself, but we can put you in a coma while you starve to death. That idea is somehow that's better is just crazy. I agree 100%. Some have concerns that suicide's more likely if it is legal, but research has found that terminally ill people in Oregon were no more likely to consider assisted suicide than people in states where the procedure was illegal. Actually, the act still remains rare, but it's giving comfort and choices. In Oregon, a little more than 1/3 haven't used the drug after obtaining them. Also in Reed Karim's May 17, 2013 article for CQ, Peg Sandine, the executive director of Death with Dignity National Center, says, I think it's a peace of mind thing. You're terminally ill and you're facing the possibility of some pretty tremendous suffering. And just the idea gives you that you can take the prescription tomorrow. You can take it if it gets really bad, provides some comfort. The truth is that doctors already influence terminally ill patients without family and patients being totally informed because it is illegal. A law would allow discussion, full disclosure, and the patient would be in control, not the doctor. The state of Montana does not have legislation, but now allows lethal prescriptions in court by court decision on a case-by-case basis. While this step is in the right direction, people should not be wasting remaining days proving that they need to end their life by their terms, and a law would provide guidelines to prevent abuse. A doctor in Montana had a patient suffering from ALS. He had lost over 100 pounds and was on a feeding tube and could no longer walk. There was no question where he was headed. The patient, who the doctor considered mentally competent, felt he did not want to wait a few more weeks for the disease to kill him. He had to inform the patient that he couldn't provide the lethal medication, so the patient stockpiled enough pain medication in a few weeks and killed himself. Dr. Kress tells us in the Reed Kareem article, Assisted Suicide, he called me a coward and said, "Who are you treating here? Are you treating yourself or are you treating me?" And he got me to thinking, what kind of doctor am I? The man was able to bring on his own death before the disease, but to what cost in the quality of his life before that? Weeks of not taking adequate pain medication so he could save enough to get the job done. Modern medicine is a great thing that can improve and extend the quality of life. These medical interventions often work and help while pushing our bodies to the physical limit. Sometimes medical treatments can cause harm to increase quality and quantity of life. Just listen to any drug commercial. Most of it is a list of things that can go wrong. This is so we can fight and we don't give up. But in the end, nature wins every time. Dying with dignity acts are not for people who are committing suicide because they don't want to live. This decision has been made by their illness and by their body. First, I told you where aid in dying stands in our country. Next, I presented some reasons for legislation and discussion on opposing viewpoints. And lastly, I gave you some ideas to think about when considering where you stand on the subject. I ask that you not only support and be involved in shaping a bill that gives the right to mentally stable individuals with terminal illnesses to not only make this decision without coercion and to also protect people involved, including health professionals and families. You can follow up on the latest legislation by getting involved by going to the deathwithdignity.org website. Thank you.